Megan, I would like to take the second part of your question about, where are we going? And then kind of loop back to Kanisha as one of her earlier questions about asymptomatic and symptomatics. I think that's really important to consider, especially when we're talking about children and they're in school, right? And in the winter time. So, for me, again, I want our children, right, to be children, as I'm sure you two do as well, right? It was very tough during the pandemic. Kids could not go to school. They couldn't see their friends, they had to be at home. So we've been so fortunate this year to transition back at least into the school system, right? So when we think about health, right, I think about the full spectrum of a child's health, right, which is school health. How do we keep them in school? Right, sports health, right? How can they play their sports? How can they be safe playing sports? Even social health, how can they interact with other children, other parents, family members, et cetera? Those are all important. Any of those aspects, right? School, sports, social, you're going to interact with other people, right? So there is a chance that they're going to get sick. We know this pre-COVID, right? They go to daycare, they can catch a cold. They go to school, catch a stomach bug, they can catch strep, right? We know this. With COVID-19, what's really important to consider is we know, and Kanisha used that term asymptomatic, is that someone could have the COVID-19 infection, not know that they have it, they're not showing any symptoms, and pass it along to someone else who then may actually develop symptoms, right? So that's important to know. And you shared with us, Kanisha, that your children and yourself tested positive, didn't have symptoms, which is fortunate. But then we want to think about the next time you come into contact with Megan for your children, we don't know what that will look like, right? So I think of a vaccine, and I've used this with many of my parents, really is like driving in a car. Right? So you drive every day. You don't think about it. You get in the car, you get to your destination safely. There's actually a lot of safety measures you have in place, right? So you get in the car, you put your child in the booster seat, you guys put your seatbelt on because that's a safety protection. That's a safety measure. That's what a vaccine does, right? It is actually giving you safety and protection. Your immune system is protecting you from potential exposure, right? You're in the car with the seatbelt. You're hoping that you don't get into an accident. There's a car bag that is, or airbag that is in your steering wheel. I make that same analogy to a mask, right? We're so used to wearing a mask now, we don't realize that it's there, but it's actually giving us that added layer of protection. You may do everything correctly as you are driving, but the safety measures are there in the event that you get hit by a car and get into an accident, right? But you know that the seatbelt and the airbag are going to protect you so you do not have as severe injury. Right? So I think about the vaccine. I want to be able to go to work. I want to be able to go to the grocery store. That is my layer of protection. I may do everything right, still come into contact with someone that passes the virus to me. My immune system may respond. They're fighting it off, and I may get mild symptoms. That is my layer of protection, is the vaccine and the mask, right? What we do not know, right, Kanisha, that's you, Kanisha, Megan, or other parents, is how your body or your child's body will respond if they get infected. So that is the safety measure that we want. So you have the reassurance when your child is going to school, when they're playing sports, when they're socializing, that they have that protection to either not get the virus by minimizing transmission or to have mild symptoms. So that's how I think about it as we try to get back into that new normal, is how can we interact safely? And the best way to do that is to get vaccinated, and that's your protection, your layer of protection. And then also masking as well is that second layer of protection.